Well, good morning. It is still morning. It's 11:30 here, and we appreciate our. Can you hear me all right, Bill? Scott, can you hear me?
I can hear you.
Yes.
Okay, good. We appreciate those in attendance today to learn about the Chamber's program that we've been partnering with the Huntington Insurance, Hummel Group, and Whitaker Myers and Roundstone Insurance as well to present to you the first Wayne Partners DirectCare virtual webinar. So again, we appreciate those attendees that are online today. One thing that we've heard through COVID-19 and through just the changing world is the ever importance for businesses to have the opportunity to cut costs, to have options when it comes to healthcare. We're proud to present this to you today. We think that it brings a great option to mid-market employees starting at 25 employees and up. So I'm not going to speak tons today because we're going to turn things over to the professionals. A couple of the formats, if you have questions while the presentation is going on, feel free to do that in the chat box. You should be able to do that. And then also after the presentation, we will make sure that you get a copy of the slides today as well. So without further ado, I'm going to turn things over to Bill McCarron. He's with Huntington Insurance. He's going to kick the program off today. Thank you.
Thank you, Justin. Thank you, chamber members. This is a product and concept that came together in discussions with Huntington Insurance with Wooster Community Hospital about trying to offer direct care to the employers of the Wayne County region and bring to them a concept that would allow them to not only purchase insurance more like a larger company, but the ability to keep more of the money in the area at Wooster Hospital. And Wooster Hospital has stepped up quite a bit to offer the best offerings as far as pricing as well. When we talked about looking at captive, Roundstone is not too far north of here in Lakewood, Ohio, and they are one of the most respected healthcare captive managers in the market. So it was a great time to partner up with them. And part of being local, we wanted to make sure we were all kind of a local enterprise, and that's why Huntington reached out to Whitaker Myers and the Hummel Agency to be a part of this, to work in the community, to try to make an offering that could bring down costs. And we know with the COVID-19, costs are very important, and the opportunity to actually keep dollars in town as well. So we're excited for this. And just so you know how committed the hospital it is, their medical group was put into this mix as well. So the medical group Bloomington has been under the captive market for 2+ years now. And we're very happy to have Scott Boyes, the treasurer of Wooster Community Hospital, to talk a little bit about the why and how their experience has been. So Scott, if you would.
All right, very good. Thanks, Bill. And I'll let Justin tell me if you can't hear me, but we're excited to be part of this program. And I do want to thank the Chamber and Chamber leadership, Kevin Day, who's the current chair, and our CEO at the hospital, Bill Sharon, for working with the hospital. Bill and I have always desired to try to find the right collaborative program or way to help local employers, particularly the smaller to mid employers who are the core of our community. And the larger employers are important to us too, but we have community at the center of our name, and we want to, how do we help everybody? We know healthcare is expensive, and it's a challenge, and it's everybody's largest expense other than the wage dollars they pay. So it is one of those challenging things for us. So we want to be part of the solution. We want to keep the profits local. One thing that I had shared with the Chamber leadership, Justin and Samira, is an article that showed that Anthem and Cigna, as an example, and I'm only going to quote facts, but their second quarter was a record profit quarter, whereas Anthem made $2.3 billion, which is more than double 2019 second quarter, and Cigna made $1.8 billion with a B, which was up 25% over their last year. And thinking of in terms of us, and we have our Bloomington Medical Services Corporation in this program, we're able to keep this year's savings with Bloomington. So our costs are running 70% of what the expect it is, so that profit stays with us. It doesn't stay with the larger insurer. So we want to do what's right for the community, and again, we want to partner. So we have offered our best rates. So the challenge for me is some people on this call, and I really appreciate everybody participating, will want to call me and say, well, hey, I want a side deal, I want to work just with you, and I want the best rates. We put our focus behind this program because we think this could be something much bigger if we can all pull together and take advantage of Wooster Community Hospital being a low-cost provider. I have data to support we're one of the lowest charge providers. It doesn't mean it's not expensive, but we try to do the best we can. And why are we doing this? You know, obviously we want to benefit for ourselves too. So we want to, as we give our best rates, we want the commitment from the local employers that you will have a tiered program to steer the business to us so that we both benefit. So you benefit from low cost, the benefit of being self-insured, but also the benefit of having your employees go to arguably one of the best hospitals in the country. We've won the IBM Watson Top 100 3 times in a row, but we just noticed that we are the best hospital in the medium-sized community hospital category, which may mean we're the best overall scoring hospital in the country with that balanced scorecard. So we're really proud of that. And again, we're committed to being a low-cost provider. The one example I wanted to give you all, just because we all have different audiences that will be speaking to us and giving us advice. So we always want to know the motivation. So our motivation, I'm clear. We want business to stay in town. We want to benefit our community. We want to strengthen our local employer base. That's our motivation. So the motivation you may also experience, I'll just share in a conversation on another captive we tried to start with our physician community. So insurance rates were killing the docs, and they were paying unbelievable amounts. Somewhere up to $75,000 per doc for their malpractice premium. Bill and I put a lot of effort into bringing a captive solution to our doctors to present to them, and we were right down to everybody signing up and being able to take this package into our own hands and benefit from managing and benefiting from the low cost environment in malpractice in our community. And the larger insurance companies came back through and bought the business fast. So there is motivate for 1 year. So then you're still subject to larger increases of malpractice premiums down the road. So I just want to challenge you, when you see these slides, understand why the big companies are self-insured, understand what may happen in a quoting cycle, but be committed that we're committed to try to make this work. We're committed to bring creative solutions to help keep healthcare costs low. So that's all I wanted to say, and certainly if you have questions, follow them through Justin, and I'm going to introduce you to David Conrad with Roundstone, who runs the captive and is really the expert in how this works behind the scenes. Go ahead, David.
Scott, thank you. I appreciate it. I've got about, I'm going to go on for about 20 minutes. I got a lot of slides, and my style is I'm just going to highlight one or two things on these slides. I suggest that's kind of what we focus on, and then Justin is going to have this loaded so you guys can view this on their links or YouTube channel or whatever it is afterwards and study it. Or you're more than welcome to call Bill McCarron with questions, or Whitaker or Hummel with questions. But that's kind of the way it's going to go down today. And then I'm going to go over definitions of what we consider middle market, or the key prospects for this. I'm going to share some of the findings. There was a recent study that 20% of the Fortune 500 companies in the United States filled out a survey, and I have listed, what they're doing in 2019 and 20 to contain costs on their healthcare plan. So we're going to share some of those findings. And most importantly, I'm going to talk about case studies for a single employer, as well as a pool of employer, how these captives have worked around the country and even locally. So actually, both of my case studies that we're going to talk about in the end are, an employer, in the Cleveland area, and a pool that it's originated out of the Cleveland area. So these are very localized case studies, very good results, and I just want to share those with you. And the last piece before we head to the next slide is I'm just going to highlight a couple things what Scott says. If you heard what, and I've heard those stats. Anthem in a quarter, not for the year, made $2.3 billion. Cigna, $1.8 billion. So for any of you on the call or any of you listening to this webinar, if you're fully insured with an Anthem, with a Cigna, with an Aetna, with a United, you think that they're going to go back to you and say, gosh, we had a great year. Our claims during COVID were down 30%. Here's some money back. No, that's not going to happen because you're fully insured. And when we go through this presentation, I just want to highlight the fact that this solution is about 85% variable costs, meaning today, if you're fully insured, you're 100% fixed cost. If you have low claims as a result of your plan is running well, there's a pandemic, whatever it is, you're going to save, up to 85 cents in the dollar if you're self-funded. Now, if you're fully insured today, you're 100% fixed cost. I'm telling you right now, Anthem is not going to send you guys all checks back at the end of the year. So I appreciate those stats, Scott. It's very, very important for today's conversation because this product is a self-funded solution. Next slide, Bill. So I think that we basically covered all these, Scott. This highlights what, it's Scott's facilities, Wooster community, all that. I think we've already highlighted this, but again, it is a world-class facility. It's in your backyard. The goal of this program is to maintain or flatline your healthcare costs, and any of the money that's leaving your coffers at your checking account, you the employer, is staying in Wayne County. So one way to do that is, this program keeps the money in Wayne County, and the savings go back to the employers. So anything else from this slide, Scott, that you want me to highlight?
No, David, I think you covered it. That's good.
Great. Bill, next slide, please. So again, the title today is, purchase healthcare like a Fortune 500. There's a quick definition. The average, I just want to let you know, the average size of a Fortune 500 has about 50,000 employees on the plan. Some of our pools, our public pools that we manage at Roundstone, we have 50,000 lives in them. So we run these pools. We help manage these pools. We work with the Huntingtons of the world to help you utilize some of the cost containment methods they use. Pull some of the levers that these Fortune 500s are using. So again, my definition of a Fortune 500, you have about 50,000 employees on the plan. Next slide. So, with the self-funding, what are they doing, to level their costs? Do you think that, I'm not saying that necessarily Sherwin-Williams, Progressive, any of those others, but do you think that a Sherwin-Williams or a Progressive go to Anthem, or Anthem goes to them and says, hey, guess what? You got a 15% renewal or a 20% renewal, and maybe we'll get it down to 8. That is not how their renewals go, So, what they do annually is they look at their trends in their claims data and they manage their costs. Next slide, Bill. Middle market for this call. So everyone on this call, I believe, is in the middle market. You have anywhere between 20 to 1,000 employees in the plan. And if you do have less than that, if you have as few as 5 employees on the plan, we do have a solution for you. You just, again, you want to reach out to Huntington or Whitaker or Hummel. But for this call's purposes, everything we're going to talk about applies to employers with 20 to 1,000 employees on the plan. And Scott highlighted this fact. The cost of healthcare is right behind payroll. It is a big expense. And most of you that are, whether you're a manufacturer or a white collar firm, generally any large expenses you analyze, why is it costing this much? What are my cost drivers? And you do something about it. So if you're a machine shop and you've got a machine that's not running efficiently, or if you're white collar and you have some costs from some, printing expenses, some vendor services, you analyze those costs and you figure out, how do I contain those? Because if those costs go up by 12, 13, 15% every year, you either have to charge more or do something, or you go out of business. But again, what this program does is it helps the middle market employer see what their cost drivers are, and then you work with your advisor, you work with Roundstone, and we analyze those cost drivers, and we give you recommended services to contain those costs. And it can be as simple as, you know, working with Wooster Community to utilize their telemedicine services. It could be as simple as using one of their clinics localized, you know, and getting your employees and your members to utilize their plan more efficiently. So there's a lot of solutions out there, but the only way to figure out what your cost drivers are is to be self-funded. Next slide. So there's a lot of information on this slide, but what I really want you to focus on is, I mentioned a little bit before, but again, Fortune 500, their healthcare costs go up at an inflationary level, 2-3% every year, not medical inflation. So for those of you on the phone that are fully insured, and some of you that are self-funded, you hear, well, medical inflation is 8 to 12%. All right. That's not how a Fortune 500 does this. They manage their costs at what inflation is. So that's where we're trying to get you. We're trying to get you, and again, and in some case studies, I'm going to show you how a pool of employers or how a single employer has managed their costs at inflationary levels, not medical inflation. Next slide. So this slide, again, a lot of facts on it, but what I want you to kind of focus in on is the top right-hand corner, group purchase approach to networks of direct primary care. Scott did a great job of saying, hey, you know, a lot of you, you know, grab me at a cocktail party or come into my office and pull me aside and say, hey, Scott, let's work a deal. You know, I want you to give me something special or different. I want you to give me something, you know. What Scott is saying, guys, is this plan is what he gives, or what, you know, what he envisions he would give a Fortune 500. So this is direct access, cutting out the middlemen, cutting out the folks that are seeking profit, a for-profit. It's cutting them out. You have direct access to Wooster Community. So again, you know, there's other things that Fortune 500s do, but the key to this whole program is, Scott opened up this presentation, is, hey, you have direct access to me now. We're in this together. And again, that's how a Fortune 500 does it. Next slide. Group captive, just real simple. Instead of, you know, there's a captive, which is an insurance company formed by a single insured. This is, or single employer in this case, this is a bunch of companies coming together, a bunch of employers coming together to form a group captive. So instead of you purchasing your health care on an island or being self-funded on an island, you're coming together as a community and accessing your health care. You're purchasing your third party, your administration services. So instead of being a 30-life employer, it's 5,000 of you or 2,000 of you saying, here's our administrative services. Give us a group purchasing number. Instead of us buying our catastrophic insurance to cover catastrophic claims as a 30-life employer, it's 5,000 of us. So you're coming together as a group to take advantage of group purchasing power. Next slide. So hit on this just a hair in the beginning, but again, those of you that are with Anthem, you know, we call them BUCAs, Blues, United, Cigna, Aetna, Anthem, maybe add Humana in there, but those of you, or an Ultra, those of you guys that are in there, I'll care, those of you guys that are fully insured, it's 100% fixed sunk cost. You're not getting any money back. These carriers are making record profits. And why are they making record profits? You know, Scott can opine on this if he'd like, but the surgeries are down, the elective surgeries are down, folks are using telemedicine, their costs are down, their claim costs are down anywhere between 20 and 40%. We'll say 30 for this conversation. Those fully insured carriers are printing money, and they're for profits. They're not for you. They're for profits for themselves, for their shareholders. So unless you're a shareholder, you're not getting any money back. So then again, that's 100% fixed cost. you have a group captive. And the way the group captive works is self-funded. And so you're responsible for claims below this catastrophic claims pick or deductible. And then you share these premiums with all these other employers. And between those two buckets of money, whatever's left over goes back to you. So if you have a good year, if there's a pandemic year where, yeah, maybe your business is down, but your claims are sure down, you save all that money. It never leaves your office. If the pool, so all the other members of Wooster community pooled their stop loss premiums together and their claims were down, they didn't have a lot of catastrophic claims, their claims are down, you're going to get money back. So 85 cents on the dollar is variable and only 15 cents is sunk. So, you know, a year like this, the cash flow of being self-funded is amazing. I mean, as good as it is for the fully insured, imagine if you were, you know, the self-insured, you would be reporting not record profits, but you'd be reporting record savings on your health plan. You know, that'd be a good position to be in. And then again, on this spectrum, I have Fortune 500s. Again, a Fortune 500 doesn't purchase stop loss insurance. They just self-administer. So they only have minimal fixed costs to pay their administrators, to pay their consultants, to pay their data mining, all that stuff. So they have very, very low fixed costs, and they pay for the claims as they incurred. But again, if there's no claims, they save a lot of money. Next slide. The average employer, and this is of our public, we manage a lot of public pools and private pools, but our average employer has 103 employees on the plan. They take the first $35,000 worth of risk on every member on the plan for the whole year. So if there's $1 million claim, the employer is just responsible for the first 35, and the stop loss covers the next 965,000. Again, that's for 100 life employers. So if you're on the phone and you're watching this webinar and you're a 40 life employer, again, you're probably going to take a $20,000 specific deductible. So the program, I'm just telling you what the average is like. It literally depends on each employer and what they're comfortable with in terms of risk taking, or how much of a specific risk for each member of the plan they want to take each other. Biggest point though on this, I want to highlight in the bottom right hand corner, the average employer that does this, the C-suite is engaged. So again, if you're a really small company, it's probably just a CEO or a president and that's it. But if you're 50, 60 lives, you might have a CFO and a CEO and maybe HR, but they're engaged in the plan. So what happens is, you know, a Huntington, a Hummel, a Whitaker, they look at your claims and they come back to the C-suite and they say, listen, everybody on the plan is taking brand name drugs and private drug or generic drugs are available. So can we have access to your employees to educate them how to use the plan better? Or let's change the deductibles and make generics free. Whatever it is, the C-suite is engaged in containing costs in this. So that, you know, that's the key here. So that the reason they're doing that is so they can level their costs off, and the less catastrophic claims there are, the more money they get back. So everybody in the program is kind of marching to the same tune, is that, hey, let's group purchase and get our fixed costs down, but let's really lower our variable costs by using the plan as efficiently as possible over time. Next slide. We've talked about Roundstone. So the only thing I want to highlight from this slide, this is not something that we're trying to do, thinking about doing. We've done this for more than a decade. We're probably, you know, the largest captive manager. We're definitely one of the first to do employee benefits in the country. So this is just a propaganda slide that just want to let you know that we do a lot of this. Next slide. So here's the fun part for me. So just on this slide, I don't want you to memorize anything, but I want you to look at a couple things. There's 25 employees enrolled on the plan. So that maybe there's 50 members or 50 participants on the plan, but there's 25 employees, okay? This is a small manufacturer. They print labels for aerosol cans. The key thing I want you to look at here is two things. Is the average employee annual savings compared to their fully insured is about $5,000. But even what's more important to me is I just actually spoke to the CEO of this company on Monday. He said that no increase for out-of-pocket expense to employees in the last 6 years. So the last 6 years, they have not had to go to their employees and say, you know, we're weakening the plan, or we need more money out of your pocket, or more contributions. The last 6 years, they have maintained their costs. And as a matter of fact, and this is, you know, December 18, I can update for 19, but let's add another 100,000. But they've saved over $500,000 compared to if they were still fully insured. The reason they went to this plan, you know, they were with an Anthem for years, but every year they kept getting these, you know, 12, 13, 12% increases, and never told why. And they finally just had enough of it. And so that's why they became self-funded. So the key here is I want you to see is that it's a long-term strategy. This employer saved, you know, more than $500,000, which is a lot of money to this size of employer. And the employees have enjoyed a straightforward plan, and there's no more money coming out of their pocket than was 6 years ago. Next slide. This example, this is kind of my example of a pool. So if we all pool together, if we join with the Bloomington, if we join with the Wooster Community Docks and form a pool, okay, we could achieve similar results. So this pool, I just want you to look at the headline. Today, they're spending 27% below the national average, okay? So the national average, according to the Kaiser annual study, is about 15.2. And the more important part of this pool, I'll give you a little background. So it's a pool of schools. There's about 6 schools in there. It's about 60 schools. They were fully insured with one of the BUCA carriers for years. And they just got another double-digit increase. And they said, you know, why are we pooling together if you know, all we're getting is double-digit increases? You know, we should pool together so it should be, you know, 2 or 3%. And so they came to us, we sat them down, and we looked at, you know, what their claims were, and we took them self-funded, because that's our only model. We took them self-funded, and the key to this slide is today, okay, in 2019, they're about to renew again for 2020, but in 2019, they're only spending $640 more than that renewal back from 2014. So think about that. So their costs have only increased $640, okay, per employee per year compared to 6 years ago. So I don't know how many of you on the phone or in this webinar can say, geez, you know, my plan costs over the last 6 years, right? If I was paying $8,000, it's now $10, $12, right? Their actual costs have only gone up $640 since 2014. So again, it's and how do you get there? It's different for every employer. You get there by working with Wooster Community and having this direct access. You get there by analyzing your claims and figuring out what the cost drivers are. Is it pharmacy? Is it they're not using primary care, or they're going to the emergency? Whatever it is, they're engaged, and the results are here because, again, your variable cost, you can save money because you're not spending it on large claims, multiple claims, and the pool's doing well, and you're getting money back. So again, you saw a single employer how they did. There's a pool how they've done overall, and again, that shows you. Not, I guess if you look at it, that's a 2.9%, you know, increase. So next slide. This is a COVID update. What I want you to do, again, we beat this up pretty good, but the second quote, you know, at Roundstone, we are seeing approximately a 30% drop in our healthcare costs. So again, this reflects kind of what Scott said about these fully insured carriers, these for-profit carriers making billions. We manage employers all over the country. Our claims are down about 30%. Because of COVID. Not the elective surgeries aren't happening, you know, so claims are down. All right. And so this is an opportunity to save some additional money. Next slide. And this is like the last slide I'll end up with. You know, is this a trend? And again, I don't want you to try to read every bullet point on there, but in the bottom right-hand corner, to me, is the most important part. Self-funding isn't something new. It's not just for the large employers. You know, 61% of the employers, you know, the private employers, self-fund. So 61% of employees out there are already doing this, you know. So it's not like it's unique to your organization. You know, almost 2/3 of the private employers out there are self-funding already. There's a reason. It's more efficient. It's a way to, you know, to save money or control costs. It's just a better way to manage your health plan. So I'll stop there, and we can open it up for questions. And Justin, I don't know if you're going to read off the questions or Bill, but you know, how do you sign up for this? Again, the contact information is on the very last slide. You would just reach out to Bill or Hummel or Whitaker, and they would collect your data and submit a proposal to us or a request for a proposal, and we'd sit you down. So anybody that's a 1-1, a 10-1, 11-1, 12-1, there is time. We would love you to look at a proposal and compare it. You know, lay it next to that fully insured carrier, their proposal. You know, what kind of increase are you gonna get this year versus how much could I save from doing this?
Yeah, we do have a couple questions. Bill,
Sure.
Did you want to cover something, or can I ask a question?
Yeah, just the same thing, just what David said. Like I said, different consultants in town are working on this, are designated to work on it, have been educated about how the captive works. So approach one of us, and we'll be glad to talk to you about how it can stack up against what you're doing now.
And David, you should be able to see the.
Yeah. So Bill, I guess Bill, I don't know if you click on the questions there, you can see how will the tiering work as it relates to in-network providers.
Yeah. So basically, and this is a good question. It kind of dovetails on a few things. Is so Wooster would be the primary where most of the claims are trying to be driven towards. So the plan would be built out with a 10% differential to encourage utilization of Wooster Hospital providers and Wooster Hospital. And then you would try to treat it at the normal level for your PPO. So your wrap PPO, besides that, you would put it at 80 or 70%. So those folks that maybe are living outside of the area can still have the ability to use the plan and not be penalized. It's just you're offering a little bit better benefit if they go to a facility that's Wooster associated, Wooster Community Hospital, and allowing them to get the employer to get better pricing, so the employee gets a better deal, and it drives them to a higher utilization for the hospitals too.
Got another one, Bill. I think you can answer this too. Can you explain to the participants how you would screen a fully insured group with no claims experience? You know, let me take that one, Bill.
You want to jump on that, David, actually? Yep.
So basically, what Roundstone's underwriters do, and we, you know, underwrite, you know, more than $100 million and hundreds of employers every year. Any employer generally under 100 employees on the plan, we don't get claims data. So what we rely on is our actuarial manuals. So we rely on the actual manuals to predict your expected claims and your max claims. And then we look at, you know, we know what Scott has shared his pricing with us. So we know if you go in there and get a knee done, right, what that's going to cost. And the last piece is we're going to see what you're paying today and what your renewal is. And that kind of gives us an idea how hot or cold you're running in terms of claims. So generally we do that. We do not require health risk questionnaires for every member on the plan or every employee. Done this for more than a decade. And I'll throw this one stat out there to you. Our employers, as an entire block, if the underwriter tells you expect to spend $1 next year, so the expected costs all in, claims, fixed costs, commissions, everything all in. If they say you're going to spend $1 next year, on average over the last decade, the average employer spent 97 cents. So we are a 3% bit conservative. Do we get it right on every single employer every year? No. But on the block of business, this is a long-term solution. The average employer spends 97% of what we say you're expected to spend. So they do a really good job of underwriting it. The second piece I'll tell you is we do decline to quote because we're trying to build pools that last and clean, if you want to say clean pools, but we do decline to quote about 20% of our RFPs for claims or things like that. So we're building these pools to last. We're building these insurance companies, these group captives to last as a long-term solution. So,
And I don't, just to jump on that, dude, I don't think anyone's saying this is the panacea for all your problems. It's a great opportunity to look at something like this. It may not be a fit for you this year, it may be a fit for you next year, but at the same time, you really should be talking about looking at this to see if it does fit you and can help you out here, because a lot of times it can.
Next question is, what is the process to enter when a present plan is on a fiscal and not a calendar year? So the way that this works is you can join at any time. So you can join a pool. So if you're let's say you're an October renewal, you can come in October and then you just renew with the pool the following January. So you can come into a pool at any time, but you have to renew with the pool. The reason we do that is because we're sending back millions of dollars of unused stop loss premiums, or premiums that were shared by the pool that were not used. And so we need to draw a line in the sand and say, all right, at this date, the books are closing, and we adjudicate all the claims for the next 3 months, and then we send all the members back their unused stop loss premiums. You know, a quick stat is last 12 months, we sent back more than $20 million to our pools of unused stop loss premiums. So, you know, that would normally, if they weren't in a captive, those funds would have been held by a stop loss carrier. So anybody on the phone that's currently self-funded, I don't believe that, you know, they got checks back of, you know, 10, 15, 12, whatever percent of their premiums. This captive allows you to do that.
Mm-hmm.
Can you explain? All right. So the next one is, how are employees outside the Wayne County area covered, Bill?
So as kind of mentioned before, and I think we touched on it a little bit here, is so the extra higher tier payment, usually at 90% for Wayne Community Hospital providers and the hospital billing as well, would be paid at 90%. And then you would just have the other people covered at the 80 or 70%, just so you can create that differential. So it's not like you're penalizing the employees outside of Wayne County. They can still be part of the captive. It's just that you're paying more for those people that are willing to use the hospital, so it's not taking anything away from the others. They're going to get covered at their normal PPO level. It just creates a third tier so that when you're advantaged on pricing, you're helping the employees get a better deal too, and you're getting them to consider Wayne Community Hospitals first of mind because of the difference in the plan.
Guys, got a
And we did change your name.
What was that?
I said we did change your name. It's Wooster Community Hospital.
Wooster Community. Yeah.
He's thinking of whole Wayne County. I like it.
Yeah. He's on the mind.
I like.
I've got one that came in here. Can we keep our primary doctor even if he or she is not within Wooster Community Hospital and still stay in network?
Yeah, so you can still, and it would just be covered at a different level, the more the second tiering of the PPO level. So in all likelihood, you would not lose that provider. I can't tell you exactly who your provider is or what network they're in, but for the most part, most of these doctors are in most of these outlying networks, so they're covered. So you should be able to keep your doctor.
And if you submit a census or submit the data on the doctors, Bill has the ability to get back and say, yes, it is, fall in this tier, or they would fall into this tier. So if you have a doctor in question or a list of doctors in question, Bill has the ability to search that and back to you with concrete, they're not in it or they're in it. And if they're, here's how it would be handled.
Yep.
But the truth is, most of the physicians in the community are within any of the companies that we use for the RAP network, so it wouldn't be any different for them. You should be able to access your doctor, correct?
Right.
So I've got one that came in, said, so what's the next step and what are ideal timeframes and how do we engage?
So to engage in the process, reach out to one of the consulting groups. We're glad to have it. I think we have a link on the chamber site to direct you if you need help in that area as well. Is that correct, Justin? There's a link that kind of bounces, or there will be a link that will bounce them.
That is correct. Yep.
Okay, so that's available too as well. And then we'll go through the process, tell you exactly what we need. Usually information you can get together pretty easily. And we'll go to Roundstone and start going back and forth, see if it's a good fit for you, and then provide you with the information based on what we find out.
In the timeline, start to finish. So if you send Bill or any one of the advisors a census, a plan design, and your current rates, we turn around the proposals this time of year right around 48 to 72 hours. And so, you know, this is not something it's going to take 6 months, but the sooner you do it, the better, because we're getting into renewal season. So if you turn it in like the end of September and want a response in 72 hours, it's not going to happen. So if there's something you're contemplating now, reach out and you'll have, you know, data back, Bill, right, with it, you know.
Yeah, don't hesitate. It's a lot quicker turnaround time than most vendors we deal with, that's for sure. So they've got it down to a science.
And don't forget to ask yourself, are you playing long-term or short-term? Because short-term, folks can buy back business, but why are you on this conference call today? Because you want to make sure, can you flatten your increases or benefit from managing your employees' health care better?
Okay, so we appreciate Bill, Scott, David, thank you so much for all the information. We greatly appreciate that. Do you guys have anything else, or can we wrap it up here?
I just want to thank the chamber for having us in and allowing us to present and talk about what we're doing. We're pretty passionate, excited about how we can help and take some more control back in the favor of the employer. So thank you.
Yep.
Thank you.
No problem. What we'll do, folks, is we will make sure that the slides are emailed to you. Also, this has been videotaped, so you'll get a copy of that, and you'll get all of the contact information for the presenters, and then also the brokers that Bill had mentioned from Hummel and Whitaker Myers as well. So there are the three companies that can help you out. We appreciate you taking the time with us today, and hope that you have a good rest of the week. Take care. Thank you.
Thank you.
Thanks.